Okay, guys, we're specifically going to talk now about hypovolemic shock. So, in hypovolemic shock, the initial insult or the reason the organs aren't receiving oxygen is low blood volume. Now, this could be because of some sort of traumatic injury or a hemorrhage. It could also be due to severe dehydration, or even burns can cause a loss of that circulating volume. So, if you guys can get the patho behind this, it'll be super easy to understand the symptoms. So, if this is our circulatory system that you're looking at here, and if this tank is our total blood volume, you'll see that the tank is low. So, what happens is that the blood that is supposed to enter and fill the heart is decreased. And so, if you remember the blood that enters and fills the heart, that's called preload. So, we decrease our preload because the volume's just not there. When our preload decreases, our stroke volume is going to decrease because there's just not as much volume. And that makes our cardiac output decrease. So our body then has mechanisms it tries to use to compensate for that low cardiac output. So you'll see a lot of vasoconstriction out here because the vessels are trying to shunt and pull that blood back towards the heart. So that means that the pressure our heart has to pump against is increased because of the vasoconstriction. So that will be our SVR is our afterload that increases our afterload. Okay. But it also means that the blood is actually shunted away from the non-vital organs into the vital organs. And so we see things like our skin becomes pale or cold because that blood flow is being shunted away from the skin. And then, of course, the heart rate is our other compensatory mechanism. So the heart rate's going to increase and it's going to try to compensate for that cardiac output. The problem is after a while, the body can only compensate for so long. So eventually we're really going to start seeing our blood pressure decrease as those compensatory mechanisms fail, because ultimately there's just not enough circulating volume to serve the whole system. So it'll start to shut down. So in our patients, the severity of symptoms we see depends entirely on the amount of volume they've lost. In the first couple of stages, they've lost a good bit of volume, but not so much that the body can't compensate. And so you may not see any symptoms, or if you do, they might be relatively minor. So again, you might see that elevated heart rate because of those compensatory mechanisms. You might see pale skin because the blood is shunting away from the non-vital organs. They might be a little cold for the same reason. And then you might start to see a little bit of a decreased urine output because the kidneys are trying to compensate by holding on to fluid so they can try to increase the pressure within the system and increase their perfusion. Now, in stage 3, this is where we really start to see shock kicking in. Again, remember that shock is a decreased oxygenation to the tissues. What's happening is these compensatory mechanisms are failing, and the patient is really in trouble at this point. You'll see their blood pressure start to decrease. You'll see their heart rate increase even more, so it'll be a significant increase. Their urine output will be very low, if not absent. They will definitely be pale. They'll be clammy. They might be cold or diaphoretic. They'll be weak. And they might even have a decreased level of consciousness because of the lack of oxygenation to the brain. So we're seeing this lack of perfusion to the kidneys, this lack of perfusion to the brain. That's shock, you guys. It's that decreased perfusion to the organs, okay? So we've got decreased perfusion to the brain, decreased perfusion to the kidneys, decreased perfusion to the skin, okay? That's your shock. So this patient needs intervention as soon as possible. Now, stage 4 is a dire, life-threatening condition for the patient. Their blood pressure will be significantly low. Their heart rate and respiratory rate will be significantly high. Their level of consciousness will definitely be decreased because they're not getting flow to their brain. This could even be to the point of them being completely unresponsive. Okay. The pulses might be thready. And they'll definitely be pale. They'll be cool and clammy. They'll have probably no urine output at this point because the kidneys are not being perfused. Now, you'll notice that stage 4 is a loss of a fluid volume of more than 2 liters. Guys, the body only holds like 5 liters of blood. So at this point, this patient has lost 40% of their circulating blood volume. So if we don't restore that flow of oxygenated blood, this patient is not going to survive. Sometimes you'll see these things and you won't really know what's going on because there's no obvious sign of bleeding or anything. This actually happened to me once in a post-op patient. They seemed fine. Their vitals were stable. They were just complaining of being weak. And they were a little bit pale, but I thought it was just the anesthesia, honestly. They started to get anxious. Their heart rate went up a little, but they were also in pain. So I just gave them some morphine. Next thing I knew, their heart rate was in the 120s, their blood pressure had dropped, and they were super confused. See this? Heart rate, blood pressure, confusion, right? So they had already passed and pushed into stage 3, and they were showing these signs of shock because their brain wasn't getting enough oxygen. I called the surgeon, and within 30 minutes, my patient was back in the OR repairing a bleed. So it's super important that you know when your patient's at risk and recognize these early signs for what they are. We want you to catch it sooner rather than later. So what's the treatment plan for a patient in hypovolemic shock? Well, we always want to treat the cause, whatever it was. But either way, we need to replace the volume that they lost. This may be crystalloids like LR or normal saline, or it could be colloids like red blood cells or albumin. Just depends on the problem. Now, sometimes we can't replace fluids fast enough to support their blood pressure, so we may need to support their hemodynamics and give them things like vasopressors while we work on replacing the volume. But it's really important to remember, vasopressors are going to constrict those blood vessels, but squeezing the tank, so to speak, does nothing if it's empty. So we always start filling the tank first, then we'll give them vasopressors. And then also, since these patients are at risk for that decreased LOC, they may have issues protecting their airway and they might need to go on to life support and be intubated. So we need to keep a close eye on their level of consciousness and their ability to protect their airway, depending on the situation. When it comes to nursing care, there's a lot of priorities for this patient, one of which being that they need to be in an ICU. So get them to a higher level of care as soon as possible. But we're going to focus on the top 3 concepts here. If you check out the outline and the care plan attached to this lesson, you'll see tons of details about specific interventions and rationales. The first concept is fluid and electrolytes, because the number one priority here is going to be to replace volume, okay? When it comes to perfusion, we'll need to work to monitor and maintain their blood pressure. So that might mean vasopressors. And then finally, these patients are definitely at risk for airway and breathing issues because of LOC. So we may need to monitor their oxygen status, and they might need to be ventilated potentially. So we need to keep an eye on that. So remember, in hypovolemic shock, the initial insult is low blood volume. That causes a decrease in the oxygen being provided to the tissues. After a large amount of volume loss, the body loses its ability to compensate, and so that progresses them into shock. We want to treat the cause, and we want to support their blood pressure during the process. So we're going to replace their volume, we're going to monitor, and then we're possibly going to give vasopressors if necessary. Just remember to fill the tank first. Nursing concepts are fluid and electrolytes, perfusion, and oxygenation. So keep these concepts in mind, intervene as necessary. And remember that shock is an emergency. You need to get help, you need to act fast, and act quickly as soon as you recognize this. We want you guys to have peace of mind and be confident knowing that you can recognize this and even save a life. We love you guys. Go out and be your best selves today. And as always, happy nursing.